There are a few aspects about it. One, of course, is COVID home deaths are not being certified as COVID, at least initially. And part of the reason is that the process starts in the cremation ground or the burial ground, and that's dependent on what the medical certificate or at least medical documentation says. That's one part. The other is often a propensity among the medical authorities to not count it as a COVID death if he or she has other comorbid conditions. Now, the WHO's own advisory issued last year in April 2020 on what counts as a COVID death is pretty clear on the instructions. So sometime in the middle of last year, many states actually went for correction in those figures. Plus the fact that in an epidemic situation, certain events can genuinely be missed. So there are all these possibilities, and undercount happens across all countries and certainly in these extreme situations. States in different towns and cities have been in somewhat different phases, as we were hearing. As Richard was explaining, Calcutta is still sort of behind, waiting for the tsunami to hit, if I may. There has been the preparations has been of different scales. What's really made news is the lack of oxygen in several states. One explanation is that where oxygen is produced, which is in limited locations, the distribution is a challenge, or rather, a very fast replenishment and maintaining that cycle is a challenge. The other issue in media discourse, at least, as well as in the government's own positions, is whether the number of intended plants, which were oxygen plants, which were planned, had actually been set up. There's certainly case with it, perhaps have been adequate.
I can hear you. Go ahead.
Okay, sorry. Yeah. So in the final analysis, I would argue that the weight is in favor of the new variants, though the behavioral explanation seems to be the dominant one, and my reasons are as follows. According to the data released by the IHME, the Institute of Health Metrics, the mask use, though never very high in India, actually fell by only 10 percentage points between August 2020 and about February 2021, down from 71 to about 61. And the mobility index increased by about 20% for the same period, but then the economy had formally actually opened up, barring some limited sectors. On the other hand, the UK variant was identified as early as the last week of December. The Punjab state, the experience of the Punjab state, the surge in cases clearly linked to the UK variant, and the Maharashtra surge again started in early February, linked to the B1617 variant. Now, why these two states are important? Because till about end March, these two states accounted for 2/3 of the national cases. And what we are witnessing in Delhi, as I said, this inexorable rise of cases very rapidly, is possibly on account of multiple mutants at play. The other aspects on which there's a lot of consternation, which is the election, the religious gatherings, and so on, they actually came on the back of these variants. They didn't precede these variants. These may have, or would in all likely to have, made the variant situation worse and led to a greater dissemination. But the importance of variants can in no way be underplayed. The medical fraternity from Uttar Pradesh has actually opposed it. They have gone as far as to say that the chief minister is welcome to actually come and visit the hospital and verify for himself whether oxygen is indeed available or not. On the other hand, there have been the odd incidents of doctors and medical personnel actually being subject to violence once they had to refuse, not necessarily in Uttar Pradesh, on account of oxygen or other amenities or even beds not being available. So it is a state of deep stress and distress, particularly for patients and their family members who are seeking beds and very basic life support desperately. Big challenge that India is facing and is going to continue to face for the next several weeks is a very large pool of active cases, nearly 3 million at the national level. And just for the city of Delhi, it's about 100,000 currently. Even if things plateau, this cumulative pool is going to increase for some time. And that's the challenge ahead. And that is a scenario where the state and the society have to work in harmony. There is no room for conflicts.